minutes in total, and the first, so with that being said, we are going to go ahead and start with team 1. So that would be Mohammed Al-Shafi. Mohammed, are you there?
Yes, I'm ready.
All right.
Can I share my presentation?
You can share your presentation. Go ahead.
Thank you.
All right, I see it loading. It's loaded, and you can put it in full screen. That looks good. And please start.
Okay, thank you. My name is Mohammed Shafi. Let me add first to thank Dr. Yusuf as I am the first presenter for this great opportunity here in Egypt and very good program. Let me then thank my lovely team who share this great work, Dr. Maha Kamal, Dr. Yomna Zagloul, Dr. Dalia Mahmoud Gad, Dr. Minna Ala, Dr. Dua Abdel Razak. Our presentation today about retinopathy manifestation in Egyptian cirrhotic patients. This is our agenda today. Okay, as we know, eye is the mirror of the body, so it knows that eye examination check for more than your vision, as many chronic disease can affect the eye condition like diabetes, hypertension, and finally liver cirrhosis. Liver cirrhosis can affect the eye through various etiologies. First, hypothesis is xerophthalmia and vitamin A deficiency, which cause severe dryness in the eye. Second, the hypothesis, which color blindness, and finally, the worst one is retinopathy, which can cause blindness, total blindness to the eye. So here, this diagram can demonstrate the communication molecule from liver to the eye, which cause diabetic retinopathy and age-related macular degeneration. As we know, pathophysiology of diabetic retinopathy is well defined for all of us, but the pathology, on the other hand, of retinopathy in cirrhosis is still unknown. We hope to find it soon. So our aim from this study is to demonstrate the prevalence of retinopathy in cirrhotic patients and to find if there is a relationship between degree of retinopathy manifestation and hepatic condition. We have to know that retinopathy is a disease of small retinal blood vessels. It has a significant negative impact on a patient's quality of life and their ability to successfully manage their disease. Retinopathy is commonly related to diabetes or hypertension. As we know, diabetic retinopathy can affect up to 4.2 million people worldwide, and unfortunately, this number is increasing every day. So we have to encourage gastroenterologists, and should they think that cirrhosis is a cause of retinopathy as well. So we decided in this cross-sectional study to take 60 cirrhotic patients from our clinic in Kafr Sheikh University Hospital based on clinical manifestation and laboratory and ultrasonographic investigations. Ophthalmic examination include best corrected visual acuity according to Snellen chart, intraocular pressure according to ablation tonometry, fundus examination after pupil dilatation, and finally imaging of the retina using Heidelberg OCT. Our inclusion criteria include all patients diagnosed with cirrhotic who came to our clinic, and we exclude patients with diabetes or hypertension, blood diuresis, or basic disease. Our result, we hope to find the prevalence of retinopathy among cirrhotic patients, and we think it will be high. And we hope to find the relationship between the severity of retinopathy and degree of hepatic conditions. There is a list of our reference to this presentation. And finally, thank you for your listening. I am done.
Great, thank you so much for that presentation. Clearly a really important topic, and I appreciated you,
thank you.
Walking us through the rationale and the necessity for this information. I think what I would like to know a little bit more about is if you're trying to understand the prevalence of these conditions among patients with cirrhosis, is there really sufficient ability to do that with only 60 patients? And might there be an opportunity to look across other hospital systems to increase that sample size?
To be honest, in literature, we didn't find any large studies about this problem or this issue. So we hope to start in Kafr Sheikh University Hospital and make it a large survey in coming time. Yeah.
Are there any other studies at all, even from different populations, that can give you an estimate of what you might expect to find?
Sorry, I didn't hear you.
So my question was, is there any literature from other populations, maybe outside of Egypt, that you can use to give you an idea of what you might expect to find?
No, to our knowledge, I didn't find any paper in literature about another population. They discuss another thing related to this issue.
Thank you.
Thank you.
All right, thank you, Team 1 and Mohammed. Next, we
Thank you.
have